Prior to having deep excision surgery in 2021, I was nauseated from severe cramps. It felt like someone was scraping my insides. The throbbing pain in my lower left abdomen was screeching for my attention while I struggled to hide my symptoms in classes or work meetings. My story is not unique. An estimated 1 in 10 people born with internal reproductive anatomy, meaning the vagina, cervix, uterus, fallopian tubes, and ovaries, lives with endometriosis. That means 200 million people worldwide, yet research shows that there is a 10-year delay to diagnosis. Endometriosis, often referred to as endo, is a disease in which endometrial-like tissue, typically located inside the uterus, grows around the reproductive organs, rectum, bladder, or other places it doesn't belong. Endo often leads to devastating effects, such as painful, prolonged menstruation, nausea, bowel issues, back pain, leg pain, and it is a leading cause of infertility. Medical diagnosis of endo is done through laparoscopic surgery, in which surgeons insert a camera to view the inside of the abdomen to identify abnormalities. However, due to cultural factors, many people with endo do not receive timely diagnoses. My dissertation is the first scholarly application of a cultural studies analysis to explore why there remains a 10-year delayed diagnosis of endo in the US. My project centers the voices of people living with endo, including my own, to shift the perception of what is determined medical knowledge by positioning qualitative interviews with patients as valid medical research. I interviewed 18 people living with endo in the US whose diagnosis took an average of 11 and a half years. 3 themes emerged from the data. First, because in the US menstruation is taboo, many of the participants in my study report how they internalized the pressure to hide menstruation at a young age. Participants reported that when they did share their menstrual symptoms, their doctors often dismissed them, saying that it was part of womanhood. Second, many participants reported how they adopted a coping strategy to publicly hide their symptoms in a phenomenon I coin as performing wellness. People with endo learn to publicly hide their symptoms as a strategy to maintain their reputation. Finally, many participants shared how their self-education and self-advocacy served a critical role in reaching their diagnosis, which is attributable to established norms and medical approaches to women's health in which patients must seek answers on their own and advocate for themselves to get treatment. This study demonstrates that although there is a medical procedure to diagnose endo, the process of diagnosis is fundamentally impacted by cultural ideas entrenched in sexist perceptions of menstruation. It took 11 years for me to get diagnosed with endo, and I hope my research establishes a pathway forward towards a medical model that will not allow people with endo to suffer in anguish for a decade.